Namaste friends, welcome to Banu Biology Center for True Learning. Here I request you to subscribe our YouTube channel Banu Biology Center for more videos and press the bell icon for latest notifications and updates. In previous video, we have encountered some reproductive health related problems. In this video, we try to find suitable and effective strategies to overcome those problems. Let us see what are the most effective reproductive health strategy is family planning. Family planning was initiated in the year of 1951 in India, has been successfully implementing and has been following by millions of people. Family planning allows people to get desired number of children and determine the spacing of pregnancies. Here, the couples have freedom in deciding the number of children they want to have and decide to spacing of pregnancy, how much time need to given or how many years of time need to given between two pregnancies. Of course there are so many benefits of family planning. One is preventing pregnancy related health risks in women. For this I give you an example. This is the evidence given by the World Health Organization. Women who have more than 4 children or at increased risks of maternal mortality. Maternal mortality means the death of the mothers. Those women have more than the 4 children are at the higher risks of mortality. Another benefit is it reduces need for unsafe abortions. So every year, so many unsafe abortions will be practiced all over the world. By family planning, that risk can be reduced. Another benefit is it reducing the infant mortality. Infant mortality means so death of the newborn babies. It is also reduced by the family planning. Then one more benefit is it empowering women and enhancing their education. So when women with a limited number of kids, obviously they find time to go out of the home and busy with some professional work and can earn the money and be proud as equal to their husbands, and also they will get the some more knowledge regarding many other aspects in the society. The another most important benefit of the family planning is slowing down of the population growth. Today the population growth is the critical and the dangerous problem facing by the entire world. So due to the family planning, the number of the increasing population all over the world can be reduced. Next, another reproductive health strategy is maternal health. I mean the taking care of the mothers in the during a prenatal time, during the maturation and during the postnatal period. Here, providing integrated evidence-based and cost-effective care for mothers is most important. Here, some facts are very crucial to and very horrible to listen also. Nearly 830 women die every day so due to complications during the delivery of the baby like severe bleeding, infections, unsafe abortions, hypertensive disorders, cardiac diseases, diabetes, and AIDS. These are the complications facing by so many women during the maturation. Here, the maternal health can be improved through the skilled care. Here, the skilled professionals need to be recruited on large scale and give the proper training for them to treat the mothers. Then, about 22 million abortions performed unsafely every year. This number is not negligible. It is the biggest number. Hardly 22 million abortions performed in a unsafe manner every year all over the world. Right? By giving the proper maternal care, we can save the mothers. The another reproductive health strategy is a proper medical care. Here, from the time of conceive till the paturation and after the paturation for 6 to 12 months of time, the both mother and baby must get with the proper treatment. The another reproductive health strategy is creating the awareness among the people. How can we create the awareness among the people? Here we can take the help of audio visuals and print media. Today many governments and non-government organizations rely on the audio visuals and print media to disseminate the information to the target people or target audience. So here the parents, close relatives, teachers and friends also play very important role in transforming the society, so by giving the proper right information. The another strategy is sex education. The sex education need to be introduced in the schools, also at the different levels of the educations. Here, the sex education mainly discourages the children from believing the myths and misconceptions. There are many myths and misconceptions in the different kinds of the society. When the proper education is given regarding the sex, all the myths and conceptions will be removed from their minds and they will get the original information about that. So the information need to be given regarding the sex related aspects, like about reproductive organs, about adolescence age, then whatever the changes taken place during the adolescence age, then safe and hygiene sex practices, then sexually transmitted diseases, what are they, how they are caused, then about the AIDS. By giving information about these sex related aspects, all the children can make themselves aware and be responsible towards overcoming these problems. The another strategy is educating fertile couple and marriageable age group. Here, the fertile couples also need to become aware of the reproductive health issues and what kind of measures they need to take and implement successfully. Like they need to aware of some aspects like what are the birth control options available, then taking care of pregnant mothers, then taking care of postnatal care of the mother and child, then come to know about the importance of breastfeeding, then equal opportunities for the male and the female child. Regarding these aspects, the fertile couple and marriageable age group individuals need to be educated. The another strategy is the providing professional experts on material supports. Here we need to talk about the well-equipped hospital for maternity purpose. Here, the strong infrastructural facilities need to be created along with the professionals. I mean, doctors, nurses, and other staff, and also various kind of materials like advanced technology should be equipped in the hospitals. These infrastructural facilities provide the medical assistance in pregnancy, treating the pregnancy, delivery, sexual transmitted diseases in case of abortions, contraceptions, treating the menstrual problems, and also treating the infertility, the problems. The another important reproductive health strategy is statutory ban on amniocentesis. In earlier videos, we came to know about amniocentesis. What is amniocentesis? Amniocentesis is a prenatal diagnostic technique which is used for fetal determination based on chromosomal pattern of fetal cells of the amniotic fluid. The amniotic fluid is filled within the amniotic cavity so in which developing fetus is freely floating. This fluid contains many things like enzymes, hormones, nutrients, minerals, and proteins. Along with them, importantly, contains somatic cells. By studying the karyotype of the somatic cells, the doctors can determine the sex of the fetus. Today, it is strictly banned. I mean, determine the sex of the fetus by using the amniocentesis technique is legally checked. But this amniocentesis technique helps in find out the chromosomal disorders. Study the chromosomal disorders like Down syndrome, Turner syndrome, Klinefelter syndrome. So this can be easily identified by karyotypic studies of the somatic cells. In India, the government of India enacted the Act for check the female feticides. Today, the misuse of the amniocentesis leads to the lowering the number of the females in the society. So because when the couples uh, came to know about the developing fetus, so is female, they decide to feticides. It this is the situation causes serious problem in the society. There will be a mismatching between the number of males and females in the society. Because of that reason, the government of India took initiation to ban the amniocentesis. Here, amniocentesis became possible in 1970 in India actually. Today, the amniocentesis used for determining the sex of the fetus is strictly prohibited. If any committed to this, they will be strictly punishable. So these are the some important reproductive health strategies can be applied to overcome the reproductive health problems. Thank you for watching this video.